And biochemical tests. Today we will be starting on this topic. This topic is mainly an investigative procedure test that we will be talking about in detail. Basically, for any assessment of a patient, what we do is when we get a patient, we assess that patient by initially taking their personal details, taking their medical history, their professional history, their present history, everything. All these histories we will take, we will examine them on observation, whatever findings we have, we will collect all those data along with and so on observation, on palpation, and so on. We will be taking a lot of informations in our assessment procedure. Beyond all this, we also go for laboratory tests, clinical laboratory tests. There are a number of clinical laboratory tests that lab scientists do for analysis and interpretation, from that analysis they come to a conclusion of what the condition may be of that patient, and accordingly they we set up a treatment program, and as the treatment is being progressed, we monitor these laboratory tests and the other tests that we have, and we treat the patient. So there are a number of laboratory tests that can be done, of which just two main categories, that is hematological tests and biochemical tests. These two tests in your clinical laboratory studies we will be studying in details. So basically laboratory scientists, they analyze data from body fluids and other specimens that are provided from the patient. They get a data and other vital informations from these specimens that are collected from the patient, and they the whole team, health working team, brings it into a diagnosis, a treatment program, and monitoring of these laboratory findings towards normal was also done by these clinical laboratory tests. Now, there are several specialized disciplines in these lab, which is a microbiological test, hematological test, immunological test, transfusion medicine, clinical chemistry, and molecular diagnosis, each of which are different in its own way. Microbiological lab test will be basically more concentrating on the microorganisms that will be present in our body. Hematological tests will be on the blood that we extract from the patient, and studying that blood from its normal structures, abnormalities വരുന്നതിനെ നമ്മൾ എന്തുവാ analyze ചെയ്യുന്നതാണ്. So these are the number of clinical laboratory studies that are present, and out of all these different laboratory disciplines, we will be only speaking about hematology and clinical chemistry or biochemical tests that are done in for assessing a patient.